Now, the Medical and Dental Council is alleged to be making attempts to change the name of registered anesthetics to physician assistants. Now, this decision by the Medical and Dental Council has not registered well with the Association of the Registered Anesthetics, and this has forced them to begin a strike which took effect from today. Now, their reason for this action is because they are not assisting anybody in the work that they do, and they are autonomous. They stand on their own as anesthetics, and so are not in agreement with the decision to change their name, hence the decision to actually embark on this action today. Now, they have written a petition to President Akufo-Addo, and they say they haven't gotten any response from him as well, and this has also forced them to begin an action today. So we are at the Mamobi General Hospital, where we'll be speaking to some of the anesthetics to find out from them what the situation here is, and we'll also be looking at how critical their work is and reason why people should be worried about their strike. So we'll be going to speak to the General Secretary of the association as well, who is also an anesthetics here, and we'll be joining him in the main theatre to explain to us what the situation is. Today is day one of the strike, and let's look at the impact of the strike. This is the Citi Newsroom, and we are at the main theatre of the Mamobi General Hospital, and I'll be speaking to the General Secretary of the Ghana Certified Registered Anesthetics to find out from them why they have actually embarked on this strike. Before then, he will explain to us. You are in the theatre now, and we can see that the place is empty. Yeah. Mr. Frederick Poha, thank you so much for joining us on the Citi Newsroom.
Thank you very much.
Okay.
You're welcome.
All right. So
I'm grateful for having you.
Okay. So this
operating theatre. Ideally, we had 2 emergencies. We should have been doing them by now, but they've been referred out.
This morning?
Yes, this morning.
Okay. So what were the emergencies? Was the emergency from the hospital within, or?
One is from the hospital, a labor case, and then the other one is from a facility that was referring in here. But the doctors indicated that they need to be sent away, so they were sent to 37 Military Hospital.
Okay. Now let's come to the reason for your industrial action. Is it not a trivial one, considering that it is a change of name that has caused you to actually embark on the strike?
It could be considered trivial, but to us, the name is very dear to our hearts because there's an act of parliament. Are you okay? That conferred the name on us, looking at what we do and what we practice. The point is that at the end of the day, you should be recognized by what you do in your practice. The name physician assistant, we said no. We don't like the name physician assistant because we don't assist in our practice. That's the basic fact. We have our colleagues at the district levels, the other facilities that are breaking their back to ensure that work goes on. They don't assist anybody.
All right. So now you have embarked on this action. You have sent people away. Are you not considering the impact this is going to have on the general public, the general populace, considering the fact that we do not have too many of anesthetics doctors or people who are doctors who have specialized. So now you are referring them to the doctors who have specialized to do the anesthetics, and we don't have too many of them in the country.
The point is, we have no option. This issue of name change has lingered on for far too long. This issue of strike started not today. We have engaged the stakeholders, the attempts in several forms by the Medical and Dental Council to change the name Certified Registered Anesthetists back to physician assistant. The first instance was where they even don't want, for example, introducing the LI, which sought to change everything that the Act stipulates. And when it was identified, we prompted the employer. The employer, we had a meeting with them, and at the end of the day, we signed an MOU with the Ghana Health Service, and the LI was withdrawn. Just not long ago, they have introduced a harmonized curriculum for all training institutions of the anesthesia schools. Already, the training schools under the Ministry of Health that are affiliated to UCC have a harmonized curriculum for which degree being awarded is BSc Anesthesia. But currently what the Medical and Dental Council has introduced is that the graduates from the schools should be awarded Physician Assistant Anesthesia. That's BSc Physician Assistant Anesthesia, which we think is in contravention with the law. And we drew attention of the employer that this is what the regulator is doing and that we are not comfortable.
Okay. When did you write to the employer?
We wrote to the employer 23rd November. 23rd December.
Okay. And what has been their response?
We've not heard anything yet. We are still waiting.
Okay.
Yes.
But then again, physician assistant is just a name. It doesn't change what you have done in school as an anesthetics. Don't you agree? It doesn't change it. You are still doing your job. Or is it the fact that you think that people will think you are assisting someone? Even though you have explained that you want to be autonomous, you are not assisting anybody. It's still a bit difficult for people to understand why the name change should erupt such or bring out such emotions.
Why should we have to be fighting over name? That is not putting food on the table. We are losing innocent patients just for name change because a regulatory body has decided that what they want to do, they will not listen to anybody. What they want to do is what they want to do. Then we leave it for them.
When Citi News visited the Medical and Dental Council, they indicated that the board was meeting to address the issue raised by the Certified Registered Nurses Association and will respond at a later date.